Good morning. Buenos dias. I hope you are well, staying positive, and focused on what you can control. We're hearing a background right now. Can you hear me fine, Marcy?
I can. Can you hear me?
Perfect. So those of you tuning in, welcome. Drop where you're tuning in from in the chat and leverage this Cafecito con HACE as an opportunity to network and chat with one another. My name is Patricia Mota, and I serve as President and CEO of HACE, the Hispanic Alliance for Career Enhancement, national nonprofit organization whose mission since 1982 is to positively impact workplaces by cultivating the pipeline of Latino talents. So welcome, and a few key announcements before we get started with our Cafecito. Charla today is our HACE Fall Leadership Programs. Now, there are many, so make sure if you miss anything that I mentioned, that you go to the website, check it out, apply if you're interested in any of these fall programs. One of them is our inaugural Hombres de HACE, so Latino male program, leadership training, a great opportunity for those getting started in their career. Our multicultural leadership program for new people leaders or those that are identified to be managing a team or ERG groups within a year. Our inaugural Trellix cybersecurity cohort, which is also for those that are interested in cybersecurity, not necessarily in cybersecurity, but leadership training to be able to support your career and get connected with folks in the cybersecurity field. And then lastly is Mujeres de HACE, our Latina leadership program. We're still accepting applications for all of these amazing opportunities for you to be able to self-reflect on your leadership capabilities, but most importantly, take action in your career and really be a leader in your community and your career. And the last thing, in terms of if you are looking for a next career opportunity, we do have a specific diversity in sports recruitment series that's taking place on July 26th. So please be sure to sign up and check that out. Everything will be dropped in the comment section. And also you can go to aceonline.org to find more information. So let's get started with our Cafecito chat today. We have our special guest, who is Marci English, Vice President, Head of BioPharma Development at Astellas. Good morning, Marci. How are you today?
Hi, good morning. I'm fine. Thank you. I'm delighted to be here.
We're delighted to have you because you are talking on such a critical topic that you are very passionate about. I know a lot of our audience is very passionate about as well, because it helps us really fulfill the mission of building equity and access for all. And this is just a component of that in such a critical way. But first thing is first, as I ask all of our Cafecito guests, including those that are joining us live, is what is your Cafecito coffee beverage of choice? How do you like it prepared, or morning beverage of choice?
I am very much a black coffee drinker all the way, just standard. And I'm very fortunate. My husband is a coffee lover, and he takes care of my coffee needs every day.
Nice. Well, that's very nice. Takes care of your coffee needs. And so those of you tuning in, please share with us. Do you have someone at home that gets to help you with your coffee needs? Let us know. That's definitely nice to have. So Marci, one of the things that I love about Cafecito is meeting leaders like yourself, sharing your personal background, your experience, but most importantly, how you got to such a critical role that you are leading today. So please tell us about your cultural, your professional background, and how you got to where you are.
Yeah, absolutely. So I have a very diverse career experiences. But just about me specifically, I live in the Chicagoland area. I have for the last 25 years, but I actually grew up in the Upper Peninsula of Michigan, and in Upper Wisconsin. My background is French Canadian, actually, which probably makes sense since we were so close to the border. But I have a master's in public health from Johns Hopkins. I went to Marquette University in Milwaukee for my undergraduate degree. And I actually started off in the labs. I was a molecular toxicologist at a pharmaceutical company, and then realized I wanted to get closer to patients and that aspect of patient care, and I wanted to get out of the lab a little bit, get away from the bench, and see where some of the research I was working on was really impacting patients. And so I moved into clinical research. I worked in consulting for a while, and got my degree in epidemiology and biostatistics, and then started at Astellas actually as a health economist. So I used some of those skills that I had developed in epi. I always say data is data. And so doing health economics and specifically outcomes research. So looking at some of the patient reported outcomes, use those skills to do that, and eventually moved into asset lead roles here at Astellas, and I'm now leading the division. So, and our division covers a lot of really important products, one of which I think we'll talk about today, which is Veoza, which was recently approved to treat hot flashes in menopausal women.
So we'll take a deeper dive. I want to inform our audience, like our conversation is on clinical trials and ensuring that there's diverse representation in clinical trials, right? And so, you know, a lot of it has to do, like some of the challenges, whether it's access, whether it's historical in terms of some of the inequities, the structural inequities that have happened over time. And a lot of it also, women in particular have been left out, right? There's been, and again, there's been a lot of progress, but there's a lot of need for continued progress. So on that note, Marci, what is Astellas doing to increase diversity specifically in clinical trials, including, as you mentioned, women's health therapies?
Yeah. So we know as an industry, we know just as people, right? Just as that it's important to have diverse representation of participants in clinical trials. It's critical for public health and improving health equity. It's really an obligation that we all carry who work in this industry, and ensuring, you know, that we have a racially and ethnically diverse patient population included in clinical trials is going to be critical to evaluating population level differences in responses to treatments. So that's characterizing whether or not some drug works in particular patient subpopulations, and what the safety profile is in those populations. And the more data we have available to support that, the more effective, and hopefully the more information we have about safety when a product is approved and reaches the broad population, we have more assurance. Astellas is really committed. You mentioned women's health. We're committed to going anywhere where there is unmet need. And certainly women's health is a space that typically the industry is divesting from. You know, there aren't a lot of drugs or interventions or therapies being developed for women specifically. And part of that, I think, is, you know, some of it's probably the economics behind it. But, you know, as we think about women as a traditionally kind of an underrepresented and underserved population, as we started the design of these trials, we did a lot of upfront research and kind of validated a lot of things that we already knew about clinical trial access, which was that we needed to improve it. And we're doing that at Astellas by, you know, number one, ensuring that we're selecting clinical trial sites that can recruit diverse populations. You know, if you're going to the same sites all the time and they have a very homogeneous patient population, you're really not gathering the information that you're going to really need to represent the safety and efficacy of a product. I think COVID also forced our industry to think about different ways to do clinical trials. A lot of health systems shut down, a lot of clinicians' offices shut down. And so it forced us to think about, okay, how do we make trials more accessible? In diverse populations, accessing a clinical trial site is is maybe not all that easy. It's not all that easy in general. The expectation historically has been, we need you to come to this particular office. We need you to, and maybe it's far away from where you live. Maybe it's difficult. Maybe you have other obligations. You can't take 5 hours out of your day, every other week to go to a clinical trial site. So COVID kind of forced us to rethink that. And that's going to improve health equity as it relates to clinical trial participation. We're doing decentralized trials now where we're having the trial come to the patients. That's an alternative clinical research model that I think is going to change our industry and change the way patients, the opportunities that patients have to participate in studies. I think the other aspect is we're really focused at Astellas on partnering with communities and community leaders. And that means, thinking about the touch points in diverse populations where they're most comfortable. And that might be in their schools or their churches or, community centers, or partnering with community leaders to ensure that we're bringing culturally sensitive education and outreach activities to those communities to foster kind of a greater awareness. And really, it's about building trust as well in these underserved and underrepresented groups.
The trust is a huge one, especially historically, right? I think there's a lot there. I think the partnering with local advocacy organizations, local health centers, even that are treating, like here in Chicago, like Alivio Medical Center, Erie House, that are working in the communities. Those partnerships are critical to ensure that building the trust and making sure that there's the diverse representation in the clinical trials. And the reason why, right, we need the diversity is so that we can be able to treat effectively, right, folks, and making sure that we're meeting them where they are, in this case, women, and there's certain diseases out there that impact some communities more than others, right? And why you need more representation, right? So I know diabetes is rampant in the Black and Latino community, for example, and we can go on and on with other areas. And so would love to hear from our audience. Feel free to chat. If you have any questions, we're getting ready to get some questions in. But of course, we want you to converse in the chat, ask any questions, share your thoughts and your opinions. But Marci, as an industry, how can we create more awareness? I think perhaps some of us here tuning in, we're learning about, clinical trials and the need for diversity in clinical trials for the first time. But how to reach groups that perhaps have been underrepresented, because access is a big piece, but also making sure once the trials get sponsored that diversity is not an afterthought, right? That it's right from the onset. It's not saying, oh, wait, we're ready to go. Like, who should we partner with, right? Like, how do we get this going? So,
So I think Veoza, which is the hot flash drug I referred to at the beginning of our call, is a perfect example of that. So that program, before it even started, we knew that hot flashes, women of color experience a disproportionate burden in hot flashes. We knew that from data, from historical data. And so before we even started our trials, we held advisory boards with advocacy groups focused on these diverse populations, and said, what tell us about the menopause experience, and tell us about how we can create those touch points so that we can ensure these individuals are included in these studies. And it was phenomenal, the feedback we got. We heard about the trust issues. We heard about the access issues. We heard about a number of different issues that we were able to address in the clinical trials. And what we saw when we look at the trials that we conducted, which were in like 3,000 women to support the approval, we saw that between just over 20% of women in our trials identified as Hispanic or Latina, and 20% identified as Black or African American. That is very high for clinical trials. That's very high. I mean, I've done studies where you just have maybe one or two Hispanic or Latino or African American patients in a trial of 150 or 200 or 500 people. And so we were really proud of that. And that really is about ensuring that you are understanding the health burden you are understanding the population, and then you are ensuring that you're doing everything you can to ensure they're included in your clinical trial program.
Yeah, well, congratulations on that. I don't think I've seen, at least from what I've read online, that high of a percentage. So that's so critical, and that's important, especially when you mentioned, right, that there's increase in terms of what women experience in those communities. It's critical to make sure you have that representation, right? So
yeah, it is.
Well, congratulations. We're proud. I know we've got an amazing partnership with Astellas to be able to engage with our community, our those that are, working at Astellas, those that are seeking, engaging in terms of the ERG groups, but most importantly, that are ensuring to push accelerate equity. And that's our big theme for this year, is across all industries, all sectors, all communities, is how are we accelerating equity united? And part of it is creating that awareness and having these types of conversations. So we'll open it up if there's any questions on the comments or the chat. We've got a few minutes with Marci. Would love to see if there's any questions or any thoughts. I think maybe perhaps folks are hearing about this, for the first time, but we have Lisandra, who's one of our colleagues from HACE. Like, how do you, and I know you touched on it, Marci, but expanding on how do you build trust within communities to gain, the participation?
Yeah. So it's unique to every situation. I would say, I referred to kind of those ad boards, and, we'd have 7 or 8 advocacy groups or groups. They weren't only advocacy groups. They were also people that, were part of those communities. And really just listening, I think, is it's a huge thing. You listen to what they're telling you, and then they can go out and say, okay, we understand this. They act then as your advocates. And they ensure that, if someone comes to them and says, hey, my doctor said I should maybe consider this, they act as advocates in the community. And they also act as educators. And that's how you start to build that incremental trust back in those communities. This isn't pertaining to VIOZA, but I know with diabetes, you mentioned diabetes early. One of the greatest successes in diabetes care has been some of the relationships between churches on the south side of Chicago, and acting as the intermediary between research in the medical community and patients, to make sure that there is kind of that connection. And I think that's it's about meeting patients where they are. Yeah. We shouldn't expect that patients are going to seek us out. They're trying already to get, equity and just healthcare overall. And so when you think about a clinical trial, that's an even higher hurdle. And we need to go to them. We need to meet them where they're at.
Definitely meeting individuals where they're at. I also think we need more folks in roles like you, right, from diverse backgrounds. I think there's a lot of stigmas in the Latino community in terms of doctors and trust, and do I take these medications? I've experienced that with my own family, my own parents, and I know it's just great hearing your story, and I'm sure you've inspired folks that are tuning in to be able to perhaps learn more, research, and get interested in the field, right, as well. So we've got to wrap up, Marci. Anything you're hopeful for, or positive story that gives you hope for this year?
I really think that what I have seen in the industry in the last even just 3 or 4 years has been a quantum leap in how we think about increasing diversity in clinical trials. I hope we keep this, momentum going. I think it's our obligation from a public health perspective, and I think it's just an obligation from a humanistic perspective. We need to, if we have therapies and we want to talk about scientific innovation, we've got to make sure we can connect it to the patients.
Wonderful. Well, Marci, thank you so much for your time, for your insights today. We truly appreciate it. And those of you tuning in, continue to engage in the chat. We want to hear from you, your questions, your comments, as we will continue the engagement there. And to everyone tuning in, until next time, hasta la próxima. Take care. Thank you, Marci.
Thank you.